Hi, and welcome to Leaside Orthodontic Centre. And welcome to Life in Braces. After you've received your braces, we're going to be giving you this Oral-B care package. And within this package is everything that you'll need for life in braces. Starting off with your very own Oral-B electric toothbrush. And this electric toothbrush will help you cover all of the surfaces that you need in order to brush your teeth. I'd like you to remember that it's important to brush 5 different areas in your mouth. So what you want to do is brush number 1, the top of the bracket. Area number 2 is the face of the bracket. Area number 3 is underneath the bracket. Surface number 4 is your biting surface, and number 5 is on the inside on the lingual surface. It's important to brush your teeth for at least 2 minutes. That might seem like a long time. I often recommend patients to put on a song, and that also helps you know how long you've been brushing for. After you've brushed your teeth, it's very important to floss in between your teeth. We provide you with this floss. It's called superfloss, and it's to go in between your teeth and underneath the wire. What you want to do is you want to create a C shape with the floss, like you're shining your shoe on each surface. And you have to floss in between each braces. We often recommend not only using the superfloss, but Dr. Arat and the oral hygiene team often recommends to use a water pick. And the water pick is a pressure washer for the gums. It's like a water gun, and it goes in between your teeth to remove all the plaque and bacteria. Next, we also provide you with an interproximal brush. The interproximal brush is like a little Christmas tree, and that little Christmas tree helps get in between your teeth to remove some of that food and plaque and debris that can get caught in and around your braces. It's excellent to put in your lunchbox or to put in your pocket when you go to a restaurant. It doesn't replace a toothbrush, but it's great to have on you just in case. Another thing that we provide you with is rope wax. And rope wax is essential at the Leaside Orthodontic Centre. We often recommend that you roll it up into a ball and you place it over the top of the bracket. And in doing so, it acts as a buffer to your lips and cheeks to prevent any rubbing and irritation that might happen. If you consume this wax, it's not an emergency. It'll work its way through your body naturally, and that is fine. After you've brushed and flossed, there could be some dryness to your mouth. We also recommend that you use the mouth rinse. It's a moisturizing mouth rinse that helps hydrate your mouth, and it allows your lips and cheeks to slide over your brackets normally and naturally, hoping to cause less irritation. So at each appointment when you'll be coming into the practice, the oral hygiene team and Dr. Arat, we will be scoring your smile. So we'll be looking at if you have excellent, good, average, needs improvement, or poor oral hygiene. And in doing that, we will be scoring that smile for you. What can happen if the plaque is left on your teeth for a prolonged period of time? You can get something called decalcification. And what that is, it's a white chalky mark that goes around your bracket. So at the time when we remove the brackets, you will have this discoloration on the enamel because food and plaque is acidic, and it starts to eat away at that enamel, causing this chalky mark. So in order to avoid that, we recommend that you brush your teeth at least 3 times a day with the flossing to remove that plaque and that bacteria to have a nice, even smile. After your oral hygiene, we discuss as well foods to avoid and foods that can damage your braces. What you want to stay away from is hard things like popcorn, nuts, hard candy, chips, especially kettle chips, Miss Vicky's, those sorts of chips that are very hard and crunchy. You want to avoid candy apples, corn on the cob. You just want to cut the corn off the cob. And caramels, sticky candies, chewing gum, as well as sugary drinks. You want to avoid that exposure of the sugar on your teeth. You can still, by all means, have a healthy diet, eating carrots, apples, cucumbers, hard bread. We just recommend that you cut up everything into small pieces to allow you to just put it into your mouth without actually having to bite into it. So when you bite into something hard, what happens is you might break the bracket off. So hard things are something that you want to avoid. Emergencies and broken brackets will happen. If you have a bracket that has fallen off, that is broken off, that you have a wire that has become long at the back and is now poking you in the back of the mouth and the cheek, please call the practice and we will for sure accommodate you and have you in to make those adjustments. After having your brackets put on, the braces, you will experience some discomfort. Your body is going through a change, and so Dr. Arat and the oral hygiene team recommends that if you are in discomfort, to use over-the-counter pain medication. We also suggest that you drink cold things, have ice cream. The reason why is because we use special wires in your mouth, and those wires are heat activated. So if you have something that's cold, it'll give you some temporary relief to that soreness and discomfort that is happening in the roots of your teeth. So welcome to Life in Braces, and good luck going forward, and we look forward to seeing you at the Leaside Orthodontic practice.